this is Miss Jane. She's a 45-year-old female who has a small bowel obstruction. So the doctor has ordered the NG tube to be placed. Before I place the NG tube, I want to check her chart to make sure she doesn't have any contraindications for this NG tube, such as recent nasal surgery or any severe head trauma or anything like that. So she's okay to have the NG tube placed. So I'm going to perform hand hygiene and put on my gloves. I'm going to introduce myself to Miss Jane, and I'm going to identify her by two identifiers, which is her name and date of birth. And I would have her state those. I am then going to identify which nostril is more patent. So I would take a pen light and shine each nostril, and I would have her close one and breathe out the other, and I would do that with both sides. So it looks like her left side is the best side to be placed. I'm going to go ahead and open up my NG tube. I'm going to go ahead and put my lube on. And I'm going to go ahead and measure from the tip of her nose to the tip of her earlobe. And then I would measure to the xiphoid process. So then I'm going to tape I'm going to take this towel and place across her chest, just in case as we're inserting she starts to gag or feels like she has to vomit. And I would also have an emesis basement present in case she needed to throw up. So I'm going to take this water and I'm going to shook her as we start inserting the NG tube, and she feels like she has to gag. She's going to sip some water. Okay. I'm going to lube my NG tube. I would have her hyperextend her neck back, and as I start inserting, have her take deep breaths. As I'm inserting, when she starts gagging, I'm going to have her bring her head forward and sip some water. And if I felt resistance as I was inserting, I would withdraw the NG tube and try again. So I've got my NG tube inserted. And in order to verify placement, the gold standard is to do an x-ray and also aspirate contents and test the pH. So I'm going to take my syringe and I'm going to pull back some contents. And if I was to get more than 200 mLs of content, I would notify the provider. So I'm going to put some in there and I'm going to test the pH. And the normal pH is 1 to 5, so if we get a pH within that range, then the NG tube is in the correct placement because it's in the stomach. So I'm going to take my contents and I'm going to push my contents back in. And then the doctor has also ordered her to have continuous low suction, and that is prescribed by the doctor, so you do have to have a doctor's order. So I'm going to now connect her to suction. If I was not connecting her to suction, I would just simply place this on her gown with a safety pin. So I've got my suction equipment here. I would set my suction to whatever has been ordered. I'm going to take my suction tubing. I'm going to connect my suction. And I would start my suction. So in order to maintain her NG tube, I would record the color, drainage, amount of her NG tube drainage every 8 hours. I want to provide oral care every 2 hours. The normal nasal drainage should be a greenish yellow color. I want to check tube placement every 4 to 8 hours before instilling any liquid, any medications every 4 to 8 hours. I want to also maintain I&O and assess her electrolytes and hematocrit to make sure she has not become dehydrated. I would also want to assess bowel sounds and her abdominal girth, and if she has any return of flatus. And like I said, the suctioning is prescribed, and I want to assess the type, document the suction that has been prescribed, and also the drainage. And that's it.